Hi, I'm Jessie. On my 20th birthday, I was diagnosed with cancer, and I spent a considerable time on life support while my doctors tried to halt the cancer's galloping course through my body. I was devastated. I was just a child. I was so young. I thought, I can't die now. I'm just starting out. After I was well enough to go home, I began the daily trek back and forth to the hospital for months of radiation treatments, followed by 2 years of chemotherapy. I was skinny, I was hairless, and I was non-compliant. Each time he gave me chemotherapy, my doctor would explain this whole complicated drug regimen. You have to take 6 pills now, and 3 pills then, and after lunch, and before bed. I didn't do it. You know, one day I might succeed in taking all the pills as I was supposed to, and some days I would skip 2, and then I would take none, and then I would take all of them again. You know, my doctor wanted me to stay home because my immune system was at low ebb and I was at grave risk for infection. I went out dancing. I look back at my behavior in awe. The millions of dollars worth of biomedical research that was distilled into the knowledge and experience and procedures and drugs aimed at a disease that was costing hundreds of thousands of dollars to treat. And it ultimately relied on the actions of a weak, skinny, scared adolescent to have its impact. I had to show up. I had to cooperate. I had to take the drugs as scheduled. I had to avoid the risks, or it wouldn't work. I wasn't a very good patient, but good enough, apparently, since I'm still here. Others were not so fortunate. I'm here today, I know, in part because of the skills of highly trained professionals, but without me, their efforts would be moot. Healthcare is a shared enterprise. What I have to do to benefit from my treatment has been brought home to me again and again through 2 additional cancer diagnoses, the treatment of a dangerous heart condition, and the ongoing management of all the conditions and risks that result from that many diagnoses and that much treatment. I'm constantly impressed with the tools that are now available to treat diseases that even a decade ago were a death sentence. And I'm so very grateful for them. But what's widely overlooked about these advances is the extent to which their success depends on our participation. We have to show up. We have to do the exercises. We have to take the pills. We have to avoid the risks, or we don't realize the benefits.